Hello, my name is Sharon Weiss of Weiss Practice Enhancement. I've been a dental practice management consultant for 20 years, and I am located here in Sonoma County. And today we are going to talk about nobody's favorite subject, which is what to do about broken appointments. And probably secondly, to managed care, this is the bane of every dental office's life. Now, broken appointments have become a really hot topic these days because not only are you suffering from the usual reasons for patients not to make or keep their appointments, but on top of that, we have the COVID concerns. So you may be suffering even more than usual. So let's take a look at what you can do that is unique and relevant to these times. I am going to make three assumptions. The first assumption is that most of your broken appointments are in hygiene. Now, if you're not a general dentist, there will be a lot of information that is still relevant to you. But I'm suspecting that most of your missed and open appointments are in hygiene because historically they've been in hygiene. And unfortunately, patients are getting the message not to come to the dental office if they can't help it. So, based on that, I'm also assuming that COVID has stressed your schedule even more than before. And I am also assuming that at least up till now, you've been doing all the usual things in contacting patients, including calling them, text messages, postcards, emails. And somehow those old routines are not working as well, if they ever worked that well now. So what I'm going to suggest is that you and your patients have a set of beliefs about dental appointments and specifically hygiene care that is getting in the way of patients making those appointments in the first place and then keeping them once they have them. Now, not only do patients have a set of beliefs, but you and your team also have a set of beliefs about dental care and especially hygiene care that you have probably never talked about up front, you've never asked your patients about, but you're all behaving your way from those beliefs. And that, in fact, is having a negative impact on your practice. So we're going to look at, well, what are some of those beliefs? Then we're going to look at what is the number one question patients ask themselves when they're thinking about whether or not they should show up at your office. Now, unfortunately, like the beliefs, patients are not voicing this question to you. So you are going to have to assume that patients are asking this question and then answer it for them before they're even weighing whether or not they want to show up. So we're going to look at that all-important question and how you can influence patients. Then we're going to look at, well, how do you build value for a hygiene treatment in the first place? So what can you as the doctor and what do your hygienists need to say and do so that everybody agrees, including your patients, that hygiene treatment is essential, especially, not despite of, but especially during COVID. And then finally, we're going to look at, well, it has come to it. The patient has called and they want to reschedule. What can your front desk do to persuade the patient to either keep that appointment or at least not become a habitual canceller? So let's look at this first idea, that your patients have a set of beliefs about hygiene treatment. Now, some of that comes from the culture at large about hygiene care. The problem is that if you've never discussed the importance of hygiene treatment and in fact have inadvertently devalued it, then they are going to continue with that negative set of beliefs. So one of the things I want you to do on Monday with your team is to really have an honest conversation. what do we believe about hygiene treatment? And I will give you an example that has occurred to me. I am seeing all these COVID statements on dental websites. Most of them have been written in May when you returned, and most of them were written by your dental web designer, and they are fine. They deal, however, with the safety precautions that your office has taken, and not so much about your philosophy of care. In fact, very rarely do I see on any website a philosophy of care about hygiene treatment. Now, if hygiene is the engine that runs your dental practice, you are missing the boat by not communicating that up front to all your patients. In addition, just as an aside, in talking about web pages, I almost never see an email address underneath the doctor's biography or the hygienist's biography. That means that if a patient has a concern about their treatment, the only person they're going to call is your front desk. Your front desk is already overwhelmed with all this other stuff. In addition, she or he is not a clinician. So really, those concerns about whether or not I should keep my appointment should go to you, not the front desk. It is a pretty easy fix just to put your email address on your website and encourage your patients to call you if they have a concern. Okay, so let's look at what do your patients possibly believe about hygiene treatment, or in fact about any treatment at the dental office. Well, number one, they may believe that canceling or not showing will not seriously affect either their dental health or their overall health. Well, if you have not made a case for the importance of hygiene treatment, not as an adjunct to restorative care, but as an essential component of their treatment plan, then no wonder they believe this. It doesn't seem to have any impact on my health, and no one has told me about any of the research that links gum disease and hygiene care to overall or dental health. So why wouldn't I believe this? It seems like it's no big deal to delay my treatment over and over. The second belief they may have is that the office, at least pre-COVID, seems so busy that who cares if I don't show? In fact, maybe the office would welcome some time out. Well, clearly you do suffer as a dental practice when a patient doesn't show. So you want to communicate two things that may seem kind of contradictory. One, our office is busy and it is hard to get a second appointment, to change your appointment in hygiene. But at the same time, you welcome them and want them to come to their dental appointment. Now, if the only way you communicate with patients who miss their appointments is a postcard or an email that says you are overdue for your appointment, you again are missing the boat. About 20 years ago, I was seeing a dentist that I liked and had been seeing her for a few years. But I was sick for about a year. In fact, so sick that I had to miss work for 6 months. Now, every 3 months, I would get a postcard from the dental office that was pretty impersonal, saying I was overdue. Now, I remember when I canceled my first appointment there and said I was really sick and wouldn't be able to schedule that day. The office never called me. They only sent those damn postcards every quarter. And after a while, I really felt like just I was a number to them. Nobody bothered to ask, how are you doing? So that means that it cannot be business as usual if you are suffering from open appointments. You have to make a concerted effort to actually contact your patients and have a conversation that starts with, how are you? How are you? At least some personal touch, so patients don't feel like they are just another number or statistic in your practice. And the third thing that patients believe, perhaps because you have taught them, is that it's really easy to reschedule. Now, one of the funny things is that sometimes the front desk, in an effort to be really helpful and really nice, will say the 4-letter response when a patient calls to cancel. Now, this 4-letter response is not what you think it is, although indeed the front desk may be thinking that word. But what she is actually saying is, okay, no problem, we have 3 openings tomorrow, which would you want? Now, I am not saying that you're going to beat the patient over the head, but neither do you need to make it so easy to reschedule that they think nothing of it. And we're going to talk a little bit about what can a front desk person say when somebody wants to cancel. Okay, in addition to those 3 specific dental-specific beliefs, most customers of any organization also have these beliefs, which is the doctor hygienist will understand my priorities. Now, things come up in patients' lives, so of course you are going to understand. At the same time, the dental office is kind of saying, yeah, I know you have more important things to do than your dental health. And we kind of buy into that. The problem, and this becomes with, this is due to your maybe lack of communication to begin with, is that the patient hasn't bought into the importance of dental hygiene care, especially in the first place. So naturally, I have another thing to do that is kind of better off for me. I am going to guess that patients don't often tell a cardiologist that they got something better to do Thursday at 2 o'clock. Why? Because the patient really values that appointment. So the question for you becomes, well, how do we influence patients so they value these appointments so much that they'll work their day around us? All the others, your office needs to make appointments that are convenient for me, and I'm doing this appointment for you, stem from the initial lack of value that patients have for hygiene treatment, especially in the first place. So while I am definitely hearing consultants recommend, open Saturday hours, open evening hours, open 7 days a week and lower your fees, that may be an option. At the same time, it's going to be a lot less expensive and frankly easier if patients bought into their appointments in the first place. There's something called the 80-20 rule. So really, you need to be spending 80% of your time on prevention and 20% of your time on intervention when the patient actually cancels. All right, so now is a juicy conversation for you and your team. What do you really believe about dental appointments? And have those beliefs changed since COVID? I have a client who, it's like feast or famine. He looks over his schedule for the next 6 weeks, and if hygiene is filled, he's a happy puppy and doesn't do anything. If hygiene is not filled, he panics, and then he sends out postcards, direct mail, to all the neighborhood around him trying to drum up new patients. So clearly, this philosophy of going from one extreme to the other is not particularly useful. What would be useful is to say, look, we can actually influence what our patients believe, and therefore, if we influence what they believe, we can influence their actions. That is where really you should be spending your time. So what are possibly some perspectives that you and the dental team have about broken appointments specifically? Well, one is that we're losing production. And that perspective is true. You are losing an enormous amount of production with your open appointments. In addition, what I've noticed about teams is that nobody really knows how much it's costing you to have open appointments. The front desk may get an edict from you, fill that schedule. And God bless her, she's doing her best. But it is a team effort, and it has to be with your written communication and your oral communication, and it has to be consistently over time that we want you to come to your dental appointments. So the idea that you're losing production is true. One of the things you need to do is, well, what is it really costing us? And secondly, the whole team needs to be aware of that, because the third thing is also true. It is going to be a team effort to get those patients back in. And you cannot look at any one patient as, you bad patient, you cost me time and money today that I couldn't afford. You really do need to look at, why has this patient failed? What is going on in this patient's life that has caused them not to come today or tomorrow? And what do we need to do as a caring company to change that situation for that patient? Secondly, because patients have maybe behaved badly in the past, you may have come to the conclusion that you and your team actually care more about the patient's dental health than they do. And this may have been borne out by experience, right? Patients nod and smile, and then they disappear. Well, one of the problems is probably the way you're talking to patients. One of the things as a dental consultant that has always bugged me is that when we talk about the doctor talking to the patients about their treatment, we call it a treatment presentation. And that has bothered me because it seems like it's all a monologue and it's one-sided. So absolutely, especially if you're having open appointments and you want patients to value their time at the office, you need to have dialogue. And it can't only be about logic. One of the things we're finding, not surprisingly maybe, is that patients, or in fact our entire country, is being told to wear masks. And this may seem intuitive. Okay, I can potentially save my life if I simply wear this cheap mask. But people are not doing that. Therefore, it is not only logic that is going to convince a patient to keep their appointment. There has to be some emotional connection, because bottom line, people, for better or worse, are making their decisions not on logic, but on emotion. And they aren't even aware they're doing it. So if you actually have more time in the office, spend that time talking more with patients and find out what is actually driving their decisions. Okay, the third dental perspective that you and your team may have about patients, especially habitual cancelers, is that possibly we can punish them out of their bad behavior. Now, this is really tempting because you are mad and you want to get them to stop canceling, or at least late canceling. So that's where you start imposing fees. Now, that may help in some cases. It may, in fact, discourage some patients, but it also angers a lot of other patients. And ultimately, what you're saying is that we give up. We need to punish you so much so that you will keep this appointment. And frankly, you do not need more fear and resentment in the dental office, right? So we will talk about at the end of the presentation, the pros and cons of imposing fees, but really it goes back to prevent the broken appointment rather than imposing punishment if you do so. Okay, I see, here we go. Well, to go back to the first point, broken appointments really are expensive. When I meet with teams, we go over a detailed worksheet where we're actually filling out what does it mean when we have an open appointment. And usually at the end of this exercise, the teams are really quiet because no one put it together before. If you want to do this with your team, you need to look at a few statistics in your practice. The most obvious is what are you losing, especially in hygiene, direct hygiene production and indirect doctor production that would have come from hygiene. Therefore, you and the team need to know, well, what is the hygiene average hourly production? So that's for a pro fee. But keep in mind that patients are also missing perio maintenance appointments, pro fees with doctor checks and x-rays. And frankly, I'm thinking they're missing those latter appointments rather than just the pro fee because they don't want to spend the extra time or money at your office. So it's significant what you could lose in just hygiene production. Then we have to look at, well, what do I usually do in doctor production that stems from my doctor exam? So that is the second statistic you need to look at. Then you need to look at, well, how many patient hours do I offer per day? And that may have lessened due to COVID. We do seem to accept in the dental industry that you will have one open appointment in hygiene per day. Now, if you have 2 or 3 hygienists and you do that for 16 to 20 days a year, that really adds up. And in some ways, it's kind of crazy that we accept we're going to have all these open appointments in our schedule. You are obviously also going to look at, well, how many of the patient hours we offer, how many of them are unfilled? Now, an interesting question to look at is to diagnose why were they unfilled. Was it a broken appointment, so a late cancellation, or was it never filled to begin with? Because your response and your team's response is going to depend on the answers to those diagnostic questions, because your actions may be very different. Eventually, you're going to look at what is the production we've lost that month, multiply it by 12, and look at, wow, that's what we lost just in production in 1 year. Now, unfortunately, this is only half the story because you're also incurring expenses, whether or not that patient showed up. So you have all your usual fixed expenses that you are incurring, whether there's a patient in the chair or not. One of the maybe upsides is that you are not incurring lab and dental supply costs because there's no work that you're doing on the patient. So you're going to look at what is my overhead costs for the month. Then you're going to look at, Well, what of that overhead cost is generated by hygiene? And that's going to be about 30%. So you're looking at your overall, and then what other costs I can attribute to hygiene. Again, how many unfilled hours do we have? And then here comes a really scary statistic. Well, those expenses need to be covered somewhere. So now it has to come from all the subsequent appointments that are actually filled. And again, if we're looking at 16 to 20 unfilled hours every month, that adds up. So when I do this with a team, we're looking at yearly production loss and yearly expenses that we've incurred. And then we add those numbers up, and it's pretty scary. But the team has to work from real information. Now, if you want the worksheet that I use, contact me after this presentation, either through my website or through Martin, and I'd be happy to send it to you. Right, so we looked at we're losing production, and that's true. The second belief is we care more about your health than you do. Now, if you really have that belief, you're going to have a sort of disdainful attitude towards your patients. And what I'm going to suggest is that your patients have agency, they have intelligence, and you need to look at who is this whole human being in front of me, and how do I relate to them so they value especially hygiene more. One of the problems, or 4 of the reasons why they don't come in, is because they didn't understand how or why you were treating them in the first place. And if you were doing a pretty traditional treatment presentation where it was you talking jargon at the patient, then really, why would they buy in? The conversation you need to have with all patients is you need to, 1, observe what you see in their mouth and their dental health. Then you need to talk about, here's what I'm recommending. And if the hygiene treatment plan is what you're recommending, you say it explicitly. And then the third thing, which is crucial, is you need to explain why this hygiene treatment plan or restorative care is going to benefit them. What's in it for me? People will pay anything if they think there's something in it for me that is significant to me. So huge. And then finally, at the end of every conversation, you need to ask, what are your thoughts? What are your feelings about what I've just described? Well, unfortunately, many clinical staff don't do that. So you have a perfunctory conversation. Patient may or may not have voiced their concerns, but they don't particularly feel listened to. So it's no surprise that they're going to conclude that especially hygiene is unnecessary and or too expensive. In a few minutes, we're going to look at, well, how does this play out in maybe the least valued hygiene appointment, which is the periodontal maintenance appointment? Because if they believe these 4 things, that canceling and or no showing will have no effect on my overall health, and I haven't bought into this in the first place, they are not going to come, or they'll show their resentment in other ways. So what exactly is the problem with perio maintenance appointments? You have to understand it from the patient's point of view. If they haven't really gotten a great explanation of how this appointment is different from their regular quote-unquote cleaning, I am not going to value it. It seems exactly like what I had before, except now I have to come in more times and it's more expensive. And when we're asking them to maybe pay out of pocket for it, where they usually had insurance cover it, we can see this has become our problem. They do not value it. I had a female dentist as a client who had a pretty funny way of describing perio maintenance. And the difference between that and a cleaning. And she would say, look, the regular cleaning is like putting soap on your shower, right? Just spraying something and wiping it down. But the perio maintenance appointment was like scrubbing the grout. And I thought, that is pretty funny. And also, I get it. If I was a patient, I would get it. So the patient must understand, why do I need this appointment? And I need to feel like I believe you when you tell me I need it. Okay. The question that patients are asking themselves before they make any appointment with your office, and they maybe already have an appointment at your office, and they're sitting at home thinking, uh-oh, here comes my hygiene appointment on Thursday. Well, should I go? Every patient is asking themselves this one question, and I guarantee they've never asked it to you directly, but they are thinking it. And it is not such a bizarre question, because you ask yourself this very same question when you're thinking about keeping your appointments or buying anything, especially a high-ticket item. But patients' answer, their own answer to this question, is revealed in their behavior. So what is this question? The question is simple. Patients are asking themselves, why do I want to keep this appointment? Not, should I keep this appointment? And let's talk a little bit about the should, because patients already know they should keep this appointment. Patients already know they should floss, but they don't want to do it. Therefore, they don't, right? So we have to look at, how do we get beyond the should into, I am motivated to do this because I want to do this. That is the essential question. So if I don't want to do this, other questions emerge, like, well, maybe I got something better to do with my time, money, and energy. Therefore, I'm going to go ahead and do that instead. If the patient wants to keep this appointment, they are thinking about, how does this appointment benefit me, either physically or emotionally or financially? Now, I bet that you and the hygienist have made some case that physically you should keep this appointment. It is good for you. But unfortunately, that only gets into the should. So as I alluded to earlier, you need to go to the emotional drivers. What is in it for me that I want to keep this appointment? And patients often reveal their motivators, inadvertently, but through conversation. And I'm going to suggest, well, you need to make a direct effort to learn what is important to this patient. So for example, if you or your dental team learn that the patient is going to a wedding, well, maybe in the future, that is a real motivator you have to use. Even in these times of COVID, when people may be thinking, well, I don't care what I look like because I'm wearing a mask. Well, at the same time, they're now seeing themselves for the first time on Zoom calls. So it could be that appearance has become a lot more important to people, even more than before. So you are going to have to learn from every patient what is important to them, Why would they want to come to this appointment? And you're going to make that obvious. Finally, the patient is asking themselves, well, are there any barriers to me coming? Are there any concerns I have about this doctor or hygienist that, I just don't want to go? And unfortunately, patients often don't voice their complaints. They just act their way out of it. Maybe they'll send a crazy Yelp review, but otherwise you will just not hear from the patient. They will, to use a common vernacular, ghost you. So if you haven't been asking your patients, how do you feel about your care here? That is a cheap and easy and effective question to be asking all your patients. Well, how do we change people's minds, at least in hygiene? And here are some things you can do that cost no money. First of all, you are all going to upgrade your language. Please do not refer to hygiene treatment as a cleaning or, God forbid, just a cleaning. Also, I have no idea what a deep cleaning is supposed to be, but apparently people refer to that instead of scaling and root planing. So the problem with cleaning is that it is a totally cosmetic process. You get your car cleaned, and if you clean it today or 4 months from now, your car is still going to work. You do not want to connote that hygiene treatment is only a cosmetic exercise. It means nothing. You do a lot more in hygiene than just cleaning teeth, and your patients need to know about it. So you, as the dentist, need to talk about hygiene treatment as real treatment, and you need to talk to all your new patients about how they're going to get an individualized hygiene treatment plan. It should also be on all your new patient welcome letters, and as I mentioned earlier, it should be on your website, right? So it should be verbal and written all the time, everywhere in your practice. You are going to link the hygiene treatment plan to better results after restorative. I don't know that dentists even mention hygiene when they're doing a debrief at the end of restorative care. But clearly, if the patient wants to protect their investment, you should talk about. The next step is to see hygiene, and here's how it's going to benefit you and the work we did today. You are going to use words that are going to have a response that people understand. You have an infection. There is blood. You have a disease. People understand these words, and you're going to make the connection that hygiene is going to help with this. So what does this literally sound like? From the dentist, you are going to say to all new patients, Mr. Patient, the most important appointment you will have in our office is your appointment with our hygienist. Not with me, with our hygienist. Because we want to prevent future problems, we will put you on a specific continuing care schedule based on your health. And it is crucial you keep these appointments. So imagine how powerful it is when you, the doctor, are talking about hygiene treatment. You are going to go on to make the connection between what we know about oral health and overall health. And then you're going to make a very timely and relevant connection about the research that is emerging literally day to day about gum disease and COVID and wearing the mask in addition, right? Very timely. Again, you're going to reiterate, let's take care of this now so it doesn't become an issue. Do not delay any of your hygiene appointments with us. Okay. Free, easy way for you to make an impact. The dentist and the hygienist are also going to appeal to the emotions of the patient and getting to know the patient's motivators. And the only way to do that is to ask patients questions such as, how do you feel about taking care of your teeth? Now, that might be seen like a give me question to patients, but it's actually an important question where you need to establish, well, really, where is this patient coming from? And then you need to ask, not do you floss, but the open, what do you do for your home care? And how do you feel about doing that? And is there anything you would like to change about what you're doing? Great, at least you and the hygienist know where you're coming from. Has anything changed or bothered you about your smile since you were last here? That is a great open-ended question for every hygienist to ask every patient. The final question is the one that I find a lot of juice in. Is there anything going on in your personal life that is affecting your dental decisions? You will get a lot of new information from the patient if you ask that simple question. Now, you're going to be having this great conversation with the patient that is going to reveal their motivators. The next thing you, the hygienist or the dental assistant, is going to do is note that, the motivators, in writing in the patient's records. And as I'm going to talk about in a few minutes, we're going to call that the reason for return, or RFR. Now, the hygienist, him or herself, is also going to build up the hygiene appointment as a real medical appointment. I am sure that your hygienists are doing an oral cancer check, but if your patients were asked, did your hygienist do a check for oral cancer, most patients would say, yeah, I don't know. And why would they know if you haven't made it obvious that you're doing it? So while you're doing your regular routine with a patient, you are going to say, here is what I am checking for now. And on the walkout slip, you are going to put oral cancer check, and then you could put no charge. So it has been what you've been doing all along, but patients didn't know you were doing it, and now you've just suddenly added value to the appointment. When you're doing the probing, make sure your patients really understand what those numbers mean. One of the things you can do is you can ask for the patient to participate. When I call out a number 4 or higher, could you count it on your fingers? So clearly, if we are using 10 fingers over and over again, the patient is getting a sense of, this might not be a great sign, but the patient is at least participating in their own appointment. And then finally, as always, the hygienist needs to make a connection between what she is seeing in the patient's mouth and also any conditions that the patient has that may make them vulnerable. And you need to say this out loud. So getting back to the reason for return, in order to do that, you're going to have to, 1, identify the patient's motivators, link the motivators and what you saw in the patient's assessments to the benefits of the next visit, and you're going to note that in the patient's records. And you're going to do that because your front desk is going to use that RFR if the patient calls to cancel. Okay, so let's look at that final belief that you may have. We can punish patients out of bad behavior. Well, let's look at the positive side first of persuasion. Rather than punishing people, let's make it a motivator. Why is it in my best interest to come here? why would I want to do that? And so you're continually talking about not only the health benefits, but the emotional benefits of keeping your appointments with us and taking care of your oral health. Secondly, people seem to want and value things more when it's not so easy to get. People like the words exclusive for some reason. So you are going to use that psychological principle and just say it is not that easy to reschedule with us. It is a truism that if you communicate that, wow, we have high demand and low availability, people might be more persuaded to keep to their original appointment. So your front desk is going to be communicating three things. One, we're really popular. We are seeing a lot of patients, especially during COVID, and it may not be so easy to find an appointment that works for you. And third, there may be some consequences to your health or your motivators that by waiting too long and getting out of your cycle. So here is how it's going to sound. The front desk is going to express care and concern. He or she is going to say, I am sorry to hear you want to reschedule. Can I ask what's going on? A nice, caring, open-ended question. What's going on? Let's say the worst has happened and the patient says, I'm sick. Great. Okay. Well, all hope is not lost. You immediately, if you're the front desk, are going to make note to yourself, we are sending them a get well card. And you're going to ask the patient, would it be okay if I called you in a week or two to see how you're doing and to see if we can reschedule, right? So this is love and care and concern from your dental office, but you are not now leaving it open-ended that maybe the patient will call back or will chase you down in another 3 months. Then the front desk is going to say, so that I can ensure this change won't affect your oral health, may I take a few moments to look at your records? Great. Who's going to say no? When the front desk looks at the records, she is looking for the reason for return. And she is going to use that reason for return as justification for why you really might want to think about keeping this appointment now. At the same time, and after that, you're going to note, quite honestly, it may be hard, therefore, to get you as equally convenient appointment. And then you're going to ask them the question, is there any way you can keep this appointment after all? The patient may say, no, I can't keep it. That's fine. At this, you are setting a precedent that it's not just so easy to reschedule an appointment. We're going to have a little mini conversation about it. And in fact, it may train the patient. Now, if you want to talk about fees, you can, right? And you can have this a part of the conversation that the front desk has. Because we may not be able to schedule another appointment into your, and use this term, reserve time, we normally charge an appointment failure fee when the cancellation is within 2 business days. And I do suggest you use the language 2 business days as opposed to 48 hours. Because we may not have discussed this before, and this is your first time, I know the doctor would want to waive this fee today. I will make a note that we had this conversation, and let's get you into the soonest available appointment. So if you're charging a fee, it is raised in a generally nice way, but you're not beating them over the head with it. Okay, that is for the patients who infrequently need to cancel. But what about your chronic late cancelers? The first thing that the front desk is going to say, can you tell me about what's happening that makes it difficult for you to keep your reserved appointments? Right? Open-ended, direct question. What's going on for you that's making it difficult to come here? And then she's going to listen. You have options, as you know. You can put the patient, if they really cannot make an appointment with you, on a quick call list. Great, got it. We will call you and we will make the best attempts. If there really is no great reason why they can't keep their appointments, you could ask for a deposit that on the next appointment. This is especially useful if it's a restorative care and it was going to be a long appointment. So you may want to do that. You may ask patients to call you when they're available if all hope is lost. But in any case, if the patient can't make it on a chronic basis, you should send a really nice letter talking to them about, here's what our philosophy is. We hope this matches your philosophy. If not, maybe this isn't the practice for you. Okay. Here is what I want you to come away thinking. The first thing is you and your team need to answer the critical question that patients all have. Why would I want to keep this appointment? And when you and your team are answering this question, you're engaging in prevention strategies. And that is where the bang for your buck is, rather than looking at what do we do with all these habitual cancelers. That means that you need to train your team in communication skills. I or other consultants can help you with that, but it is critically important. And if the last time you had a staff meeting was prior to you returning, it is high time you talked about these issues. If you want any of the scripts I talked about or the hygiene profit loss statement, contact me and I will send that to you. So my business is to enrich the lives of dental leaders so that they and their teams and patients can flourish. I do monthly consulting calls with dentists. During those calls, we track and look at your statistics, your production, collection, and expenses, and that guides us to what actions we need to take. I also do in-office, at least prior to COVID, and now online training that can be an hour or a half day or multiple days. In addition, if you realize I need to have more staff meetings, but I don't have the time to plan them, I can do that for you and we can have virtual staff meetings. In a few weeks, I will be leading a free online course that deals even more specifically with building hygiene in the time of COVID. This is a free course. It's called, Is Your Hygiene Department a Ghost Town Due to COVID? And I'm pretty much hoping you're going to say no to that. But it is November 20th, 9 to 10:30. I'm limiting it, participants, because I do want us to have a conversation about this very crucial topic. So at this point, I am welcoming any questions if we have some. Otherwise, I know you're getting a questionnaire after this presentation, and I urge you to fill it out so you get CE credit. A quiz. Not that hard questions, but if you were listening, you should be able to respond to them. So thank you. This is Sharon Weiss at Reds, and have a great evening.